We all know that the medical textbook explanation for nearly all chronic diseases is that they result from a combination of genetic predispositions and environmental factors. My way of looking at this is to say that we really can't do a lot about genetic predispositions, although in certain selected cases we can influence gene expression enough to get a favorable clinical outcome. So what I want us to focus on here are the environmental factors. However, instead of just saying environmental factors, we need to define what those environmental factors are. And that's what I've done in the list that you see on this page. Diet, microbes, immune imbalance, mitochondrial dysfunction, lifestyle, stress and sleep, hormonal imbalances, and toxin exposures, whether those are chemicals or heavy metals. So you need to memorize all of those. Non-modifiable mechanisms include the genes that we've inherited from our parents. The modifiable mechanisms include diet, dysbiosis, nutritional immunomodulation, mitochondrial dysfunction, psychoneuroimmunology, hormonal imbalance, xenobiotic immunotoxicity. So we need to memorize those, and we need to implement those into a clinical strategy that we can use very simply and with great facility so that we can then liberate our mental capacities to focus on other details. Also note that the standard medical evaluation fails to consider these important modifiable components other than a little bit of lip service to diet and lifestyle. So I want you to consider memorizing these 7 items because this is going to be the focus of our clinical interventions. So you'll notice that that list is actually pretty hard to memorize. For that reason, we're going to use a mnemonic, which I've detailed on this page. So we're going to simplify that complex list into something more manageable, and we're going to focus on memorizing these 7 items: food, infection, nutrition, dysfunctional mitochondria, stress, psychology, and lifestyle, or style of living, including sleep hygiene, endocrine imbalances, and xenobiotics and toxins. So I've now taken a complex list and made it more simple, and now we're going to use an acronym from that list to make it simpler yet, and that acronym is FINDSEX, or you could say FINDSET, and I'll show you how to use that in just a moment. Interestingly enough, I first presented this new model and acronym in the city of Paris in 2012. So for those of you who are interested, on this page I provide the origin of and a few updates to the functional inflammology protocol. I start with a little bit of my own personal and educational background, also my background in naturopathic and functional medicine, how I developed the functional inflammology protocol initially for my graduate students and postgraduate audiences in Europe, and then an update to the protocol in 2017. I added neuroinflammation as the 4th category of inflammatory conditions. The benefit to using the functional inflammology protocol as a clinical tool is that it provides the clinician a structured organization of the major concepts that we need to address clinically in order to help our patients be liberated from these so-called chronic inflammatory diseases. So the first step in liberation from these conditions is to stop calling them chronic diseases and calling them sustained diseases. So we ask the question, what is sustaining this disease process? Is it dietary indiscretion? Is it carbohydrate excess? Is it lack of exercise? Is it microbial colonization or small intestine bacterial overgrowth? Is it mitochondrial impairment due to a viral infection or due to xenobiotic exposure, for example, with pesticides in the food? We have to start asking different questions if we're going to get different results. If all we want to do is manage high blood pressure by lowering the numbers with drugs, we can do that. If all we want to do is lower blood sugar by giving our patients so-called anti-diabetic drugs, we can do that too. But if we want to liberate them from their diseases, and if we want to improve our true clinical success in the management of those conditions, then we need to ask different questions, search for other causes, and find other solutions to help these patients restore homeostasis and metabolic health. So again here, what I'm suggesting to you is that we can use this clinical protocol very efficiently because it is structured and well organized, and that liberates our mental capacity to be free in order to find creative solutions to these problems. You'll agree that the acronym is very easy to memorize. Hopefully some of you have already memorized it. What are the 2 words that represent the 7 areas of our main clinical considerations for modifiable factors in these disorders of sustained or so-called chronic inflammation? Again, what are the 2 words that represent the 7 areas of our clinical focus? So again, we've got 4 categories of inflammatory conditions: metabolic inflammation, allergic inflammation, autoimmune inflammation, and neuroinflammation. Now, how do we address those categories of inflammatory conditions? We do that by using this protocol, which focuses on 7 areas of clinical and pathological importance, and that's what guides our treatment. So the pathologic triggers for these inflammatory conditions typically comes from one or more or all 7 of these areas of focus. And by addressing these 7 areas of focus with individualized treatment, we can then gain better success in treating our patients. So what exactly is a protocol? A protocol is a plan or a default mode of behavior and thought. Protocols can be strict or flexible, and I'm encouraging you to use this on a rather flexible basis. If your patient comes in with a given problem, I want you to use this protocol, but that doesn't mean that you wouldn't address the patient's acute needs with drugs if necessary. So this is a default mode of thought and behavior that can be applied with great flexibility to meet the needs of the clinical situation with each individual patient. And of course, protocols can be abandoned altogether when circumstances call for a different course of action. Such as in my clinical experience one time, I remember seeing a rheumatoid arthritis patient who presented with transverse myelitis. So obviously in that case, we had to move not necessarily directly to diet and lifestyle, but to anti-inflammatory drugs to control that transverse myelitis. So again, acute exacerbations may require acute medical therapy, but we always have to maintain our focus on addressing the underlying causes of these inflammatory conditions so that we can liberate our patients from their diseases and so that we can attain greater success in our clinical practices. So what this provides you is a default plan of action that can be used reliably in most clinical situations. Obviously, again, we customize this per patient and per clinical situation. Here's another way of visualizing these major components. Again, food and nutrition, infection and dysbiosis, nutritional immunomodulation, dysmetabolism, and dysfunctional mitochondria. The acronym for those 4 categories is FIND. Then we move to style of living, psychology, sociology, sweat as a metaphor for exercise, stress, sleep, special considerations with supplementation, and those special considerations can also include surgery. Then we look at endocrine function and balance and also xenobiotic load. So style of living and most of those special considerations start with S, then we go to E for endocrine and X for xenobiotics. So that's SEX. So the complete acronym is FINDSEX. That's easy to memorize, but not necessarily an acronym that you would want to write in your patient chart notes. So in category number 7 here, you can change the X for a T and just call them toxins, and you are looking for a set of problems and a set of solutions. Again, FINDSEX or FINDSET. Food infection, nutritional immunomodulation, dysfunctional metabolism, stress and style of living, endocrine imbalances, toxins, and xenobiotics. So we're going to add this on to our way of managing and medicalizing these patients. If a patient needs drugs, they need drugs. But at the very least, we also need to address their diet, lifestyle, hormone imbalances, and toxic exposures. So let's start now by looking at food, diet, nutrition, and lifestyle. So for example, in American medical schools, we commonly use what's called a SOAP note, and that SOAP stands for subjective, which is the patient's concerns and complaints. Objective are our clinical findings, assessment and diagnoses, and plan, which includes treatments, tests, referral, and follow-up. And what I'm proposing here is that in addition to our regular clinical routine of subjective, objective, assessment, and plan, that we simply add on a more detailed plan that includes addressing food, infection and dysbiosis, nutritional immunomodulation, dysfunctional mitochondria, stress, sleep, and style of living, endocrine and hormonal problems, as well as any toxic or xenobiotic exposures. And you can see that perfectly demonstrated in the amended SOAP note that I've shown on this page. So now let's see how to apply this in clinical practice. First of all, we have to appreciate that diet indeed induces systemic inflammation. So this was a radical idea, say 20 years ago, when my friend David Seaman wrote this article, The Diet-Induced Pro-Inflammatory State. Now, this knowledge should be pretty widespread that diet does indeed contribute to sustained or chronic inflammation. So if a pro-inflammatory diet is the problem, then obviously the solution is an anti-inflammatory diet, which I've defined here as a 5-part nutrition protocol, which I call the supplemented Paleo-Mediterranean diet. This is a diet that emphasizes fruits, vegetables, nuts, seeds, and berries, and high-quality protein. For each patient, we may need to customize the diet to tailor to their food sensitivities and intolerances. So, for example, most of us would agree that citrus fruits are a health-promoting food, but some people have allergy to citrus, so we have to help them avoid the foods that they're allergic to. Likewise, with beef, milk, chicken, or fish, those are health-promoting foods for the majority of people. However, some people will be intolerant, and so, of course, they need to avoid those foods.